Welcome back. With the new school year underway, there are a few health checks parents should keep on their radar. We're talking today about vaccines, vision and hearing, and what we should be watching for at home. So here to walk us through this is Isabel Valdez, a physician's assistant with Baylor College of Medicine. Good morning, and thank you for joining us.
Good morning. Happy to be here to help out.
Okay, so we are a couple of weeks into the school year for some of us. Let's start off with those vaccines. We've been seeing in the news more vaccine exemptions among kindergartners. What does this mean for kids as they head back to school?
Well, we know in general that vaccines help protect not just the individual child, but it also helps protect the entire classroom. So when the vaccine rates have fallen, we do seem to lose some of that community protection that helps keep the infections at bay. So one infected child can actually have a pretty big impact on the entire group of students who are not vaccinated. So checking in with your pediatrician to see what vaccines your child is due for, anything from MMR to influenza, may help improve those odds.
Okay, so I was just going to ask about that. Which vaccines should we all be making sure that our child is up to date on, and how do we find out what they are due for? Is it that conversation with the pediatrician?
Absolutely. And if you want to prepare yourself ahead of time, you can always check out the American Academy of Pediatricians. They have a great website called healthychildren.org, which actually has a vaccine schedule by age. But in general, you're talking about the DTaP, the polio, MMR, chickenpox. That's usually for the younger kids. Older kids may need the Tdap or the meningococcal or the HPV vaccine. And of course, the yearly flu shot is always one that comes around the corner. And in fact, it's coming up soon.
Okay, yeah, it's just around the corner, like you said. Okay, so that's the vaccines. Let's talk about vision, okay? What are some signs parents might notice at home that could signal a problem in the classroom or the rest of our kids' lives?
Well, we'll start with vision, right? Because that's one of the ones that might be a little more obvious to see. If you notice that your child is holding their books really close to their face, or their iPhones or their iPads are really close to their face, or you'll notice that they're making things larger, that may be one sign. If you notice that they're squinting, sitting too close to TV, if you catch them rubbing their eyes, or they start like seeing things with just one eye like that, that may be a sign that they're trying to focus a little bit better, because one side might not be. And of course, just this really random one of headaches. Headaches are something to always pay attention to, kids. Headaches can mean anything, but one of those things could include vision changes.
Okay. How about when it comes to hearing? What are some of the less obvious signs that we could watch for that could affect a child's ability to learn in the classroom?
This one's a tough one because we know kids have selective hearing, especially in the morning rush. But if you notice that your kids they're wearing their headphones or their hearing buds so loudly that you can hear them in the next room. And if they're actually also, if you notice that they're mispronouncing words, especially when they're younger, it may not be that they're mispronouncing them because they're still developing their speech. It may be from that, but it may also be because their difficulty in hearing may be how they're actually interpreting that sound. So if unclear speech, if you catch them that they're not speaking well or they're not pronouncing well, and also if you hear that they're listening to their hearing devices really loudly, it may be something that it may be a subtle change with their hearing that you may want to get checked.
And I think the school nurse is always a good resource as well, right? To reach out and ask those questions and see what they see in all of this.
That's right. In the state of Texas, there's actually some mandated screening for hearing as well as by the school nurses. So there's always going to be that test there at school with the school nursing, but also even asking their school teacher, like, do you notice that they're falling behind on their hearing or on their reading or in their comprehension or in their conversation with folks? That may be a sign as well.
Okay, great advice, Isabel. We want everybody to have a great start to their school year, and just paying attention to these things can make a big difference. We appreciate it. Thank you.